Hello, ladies and gentlemen. It's a pleasure of me to be as a presenter for today's session. And I'm Dr. Kye Mon from Universiti Tunku, Rahman, Malaysia. So today I'm going to present about our research entitled of Evaluating Educational Environments of Medical Program, a Qualitative Study. So as introduction, we'll discuss a bit about the educational environment. So educational environment of the educational institution is where teaching and learning activities occur, and it is a major determinant of augmenting students' motivation, facilitating effective learning. Educational environment refers to the climate of where the learning happens and plays an important role in students' academic achievement, satisfaction, and success. The evaluations of educational environment has been carried out to identify the strengths and weaknesses of their students' learning environment, and it is also important to evaluate the educational environment prevailing in the medical program for various purposes such as quality assurance, accreditation, or funding sources, or to sustain ongoing program development and improvement. And among other evaluating methods, students' perceptions of the educational environment reflects the effectiveness of the teaching, learning, academic progress, and sense of well-being of the students. So by doing this study, the informations from the evaluations are useful to decide about the value of worth of educational environment and useful as evidence to support the needs of implementation of effective evaluation tools. So in view of this, we have conducted the study with the objective of to explore the in-depth perceptions of educational environment among the preclinical and clinical year students of UTAR. So I would like to explain a bit about the medical program in UTAR. Medical program in UTAR was established in 2009, and it is a 5-year program, and it was conducted in two campus, preclinical years in the main campus, that is a UTAR Sungai Long campus situated in the Selangor, Malaysia, and the clinical years, year 3 to year 5, conducted in the Clinical Teaching Center Ampang, which is 20 kilometers away from the main campus. So these are the some photos of the Sungai Long campus, and this is the Clinical Teaching Centers, and this is the hospital that they have to go for the clinical rotations for clinical year students. So a cross-sectional qualitative study was conducted among the students to get the in-depth information of perceptions regarding their educational environment. A series of the focus group discussion was conducted to explore the strengths and weaknesses, and the interview protocol was based on the Dandy-Ready educational environment measure. Before 1 month before this study, we have conducted the quantitative study by using dream inventory. And there's some the areas that need to explore were explored by using this the qualitative focus group discussion method, so that the interview protocol is also based on the dream inventory. So we used 5 domains, the same like in the quantitative study, like student perceptions of learning, student perception of teachers, student academic self-perceptions, student perception of atmosphere, and their social life. Actually, in a quantitative study in a dream inventory questionnaires, there are total 50 items in the 5 domains, and 9 of the items are negative items. We use the theme but not exactly like this, but we adopted using from these items in our interview protocol. So the participants are selected from each academic years, and by simple random sampling, and the informed consent was taken. And each focus group discussions, the students, the 8 to 10 students are involved, and there are total 38 students for 4 focus group discussions who participated in this study. So data were analyzed by the qualitative study. The analyzed by thematic analysis, and ethical approval was taken from the ethical review committee of the UTAR. So as a result, we divided in with domains, and according to the domain and the student perceptions of the learning, the preclinical year students they enjoy their learning, their sessions as the they enjoy to participate. The teaching is the student centers, and they help to develop competency. But only their concern is that some of the lecture classes are overemphasized for factual learning. There are quite a lot of the lecture slides within the 1 hour. So the recommendation was made that the students they would like to have recorded lecture sessions, and then so that they can listen back again anytime to the areas that they miss out. And student perception of teachings, they all stated that their teachers are knowledgeable and are prepared for their classes, and they also get the feedback from the teachers. And the preclinical year students don't have any problems related with the teachers, for example, authoritarian or angry teachers. Regarding the students' academic self-perceptions, preclinical year student has a good academic self-perceptions, but their concern is just as I mentioned before, their lecture classes are quite overloaded with the factual learning. Some of their classes, so that some of the subject they need to memorize, so that they would like to have a more small group sessions rather than the lectures. Regarding the atmosphere, they enjoy their atmosphere. The learning atmosphere though is motivating and relaxed, and they can discuss freely. And they are regarding the social life, they enjoy their students' life as they have their social life with not only the students from the same faculties, but also from the other faculties in the main campus. So, but for the clinical year students, regarding the student perceptions of learning, they also enjoy their teaching sessions, learning sessions, and their only concern is that they have some issue of the changes in the timetables, and also the issue with the extra classes. It is compared with the similar to the other studies stated that clinical teachings hour, because the clinical lectures are conducted by the consultant, so that there will be changes in timetable based on the availability of the clinical consultants, and regarding the extra classes, but it is good, but some of the students have a difficulty in concentrate because there are quite a lot of the classes in the day. So regarding the teaching, all the students agree that their clinical teachers and consultants are competent, and not only for the teaching but also in the treating the patients. And but some of the students stated that some of the teachers are authoritarian, maybe because of we say some of the senior teachers, they teach in a way like in with the experience more the senior style and the old style compared to the teachings by the directions. So recommended what was made for these lecturers to be more involved in the best sides of the teaching style and giving feedback, so that it will be better for the students. And regarding the academic self-perception, the clinical year student has a very good academic self-perceptions, and they are regarding their the competency, as well as they are quite confident for sitting for the exam as well. And regarding the atmosphere, it is they stated that their classes, the atmospheres are they enjoy their learning atmosphere, but there's quite limited facilities and clinical teaching centers compared with the main campus. So regarding the social life, student perception of the social life, clinical year students, they have a good friends, but concerned with their social life, there are quite limited facilities near around the clinical campus, and but also they also all busy with the clinical walks and clinical teaching, so that they could not participate they are in other social life compared to their during their preclinical years life. So regarding comparison between preclinical year and clinical year students, in terms of the teaching, in terms of learning, they both students enjoy their learnings, but the preclinical year students prefer more discussion session. As I mentioned before, it is because they are quite they concerned about the factual learning, and for regarding in terms of teachings, the clinical preclinical year students was fine with the lecturers, but clinical year students, they mentioned some of their lecturers are authoritarian, sometimes they got angry in the class. And for regarding in terms of the atmosphere, yes, compare with the both campus, preclinical year and clinical year campus, the teaching campus is limited facilities, so that they would clinical year students suggest to improve their facilities in the atmosphere of the clinical campus. And for regarding their social life, the preclinical years, compared to the preclinical year and clinical year students, preclinical year students enjoy their social life because they study in the main campus. They have quite a lot of faculties like the engineering, the accounting, and they can enjoy their students' life with quite a lot of the social life with the other faculties students. And but for clinical year students, they have to study in clinical campus that is quite away from the main campus with the limited facility, and also because of they are busy the clinical works, they cannot enjoy quite life the student life much compared to the clinical year students. So as conclusion, educational environment affects the student learning and development, and poor educational environment can hinder the efforts of even the most valuable teachers. And also the dream inventory is a reliable and validated instrument which identifies the problem areas in educational environment, as they are stated as the 50 items. And the use of the dream as a monitoring tool will permit timely interventions to remediate problematic educational environments. But it was recommended to explore in-depth qualitative interview for the student perceptions after the quantitative study by using the dream inventory, so that it would be to make sure that you can explore all the weak area that in the items which are not stated in the dreams. So as a take-home message, the in-depth explorations of the items of the dreams apply to identify the strengths and weakness of the educational environment of their the respective educational program, and also serve as the monitoring tool to permit timely interventions to remediate the problematic educational environments. And the findings of the study provide the guidance on what we need to be maintained and addressed in UTAR Medicare program. With that, I would like to thanks for your attention. Thank you very much.